Plantar fasciitis is one of the most frustrating and annoying conditions you could possibly have. Maybe you went on vacation somewhere where you had to walk a little more than usual. Maybe you just came down too hard off a curb and it sent pain right to your heel. However you did it, you went to bed hoping the pain was going to be better the next day. But instead, the plantar fascia curled up in a little ball, and with your feet pointed down underneath the sheet, it prayed that you never took another step again. But lo and behold, the next day you put weight on your feet on the bedroom floor to walk to the bathroom with that angry report of pain in your heel. Despite wishing that it would feel better the next morning, the pain in the heel is exactly the same. The plantar fascia is starting to heal. The body is trying to patch up these micro tears with irregular lower quality tissue, but you end up breaking that up with your first few steps in the morning. Now, throughout the day, the tissue does warm up and becomes more pliable, leaving strands of collagen resistant to tearing that will eventually allow it to heal properly. But for now, the plantar fascia gets inflamed with prolonged walking and being on your feet. So with your feet inflamed by the end of the day, you go to bed and repeat the whole darn process over again, healing a little at night, inflaming it through the day, and having the pain increase by the time you get home from work, only getting relief when you put your feet up. So how do we break this cycle? Well, I'm going to show you what I do as a massage therapist and as a personal trainer. First, we'll start with 2 taping techniques, and then I'll show you some ideas for body work, and then I'll show you some exercises that I would do. There are a lot of taping techniques out there for plantar fasciitis. The one I'm going to show you is what I like best on myself and what I use in outpatient PT as a PTA. It's a kind of modified low dye technique, which you'll see a lot on YouTube. With low dye taping, athletic tape is usually used. This one uses straight up leuco tape with no cover roll underneath. It's applied directly to the skin of the foot, and you don't have to worry about skin breakdown since the skin on the bottom of the foot is the toughest on your whole body. So with this technique, you first put a strip around the perimeter of the foot with no pull, just laying it down, just trying to iron out the wrinkles as much as possible. And then you lay a bunch of shorter strips pulling from the outside of the foot to the inside. And this can be a bit tricky since it's easy to pull too much and scrunch up the metatarsals in your foot like a bundle of sticks. All we are trying to do is give the transverse arch a little bit of help, giving it a bit of external scaffolding so that the foot can absorb shock better. And that's really how it works, to improve shock absorption and maintain some rigidity into supination to help the plantar fascia while it's trying to heal. So if you either wear shoes with a narrow toe box or turn your foot out when you're walking, the result is that you can pull the abductor hallucis muscle that runs along the inside arch of your foot. And this can close off the medial plantar artery, which actually feeds the plantar fascia. And it's this compromised circulation that leads to degeneration of the plantar fascia, and that degeneration will leave it vulnerable to injury in the first place. So if you already have plantar fasciitis or don't want it in the future, one thing you can do is make sure that your big toe is not being pulled to the outside. And there's a lot more to say about this, and that's why I'll leave a link to Carol Robbins' website, who is a restorative exercise specialist, who I consider an expert in this area. Her courses will take you step by step on correcting your biomechanics in your leg. Now, that aside, this is a taping technique that I do with stretchy dynamic tape. Here I've cut it in the middle to make it half the width. I usually use rock tape or KT tape. So the first thing I do is start with the top of the foot near the cuboid and putting a no stretch on the anchor. And then with a little stretch, I move up to the big toe, wrap around it from the outside to the inside, and then with a little more pull, bring it down to the medial arch. Not putting stretch on the very end of the tape. This will help keep the toe in a proper position as you step and push off. Okay, if someone is seeing me for massage and they have plantar fasciitis or symptoms like it, I will usually work these techniques into the routine. Here I'm simply spreading apart the first and second metatarsal to help that big toe straighten back out. This is something you can even do at home. And this with a big toe extension stretch is perfect. Next, I either use my thumb or a handheld instrument like this A-stem tool to run along the fibers of the plantar fascia. And here I'm also using Dyson, which is this non-slip silicone, to hold just distal to the plantar fascia to dampen the pull on that painful attachment. The idea behind this is that I'm helping mobilize the non-irritated region of the plantar fascia so that the force along it when you take a step is more evenly spread out and not just overly tense at the attachment site. To me, the ideal time to do this is in the morning, even before you get out of bed, so that the initial walking on the floor isn't so bad. You're sort of beating it to the punch, so to speak, or you're pre-mobilizing the tissue. Now this is similar to the old rolling something along your foot with a ball or a roller in the morning. And that technique will get a little deeper, I think, mobilizing more of the toe flexor muscles which are deep to the plantar fascia. And this wouldn't be a bad idea though, because a lot of times these muscles have trigger point since they are stressed too. And many times I'm looking for trigger points that mimic plantar heel pain as well, especially the soleus and posterior tibialis. I will glide over these muscles first, warming them up, and then working my way deeper to see if there are any discernible trigger points, kind of like speed bumps that I'll feel along the way. The posterior tibialis is the deepest, but you can still affect it with pressure on the muscles above. Okay, so if you are turning your leg out or your foot out, which is not what you want to do when you walk, there will be some tension along the muscles that pull the leg out, like the vastus lateralis, the iliacus, and the deep hip rotators. So I'll show you how to deal with these mobility issues. At first I have the right leg here hanging off the table with the quadricep already on some stretch. If someone is very tense, I may try bending and jostling the outside of this quadricep and try something called reciprocal inhibition, which is simply getting the muscles on the opposite side to fire to turn off the quadricep and the hip flexor or the iliacus. For the actual massage, I like to start by warming up and preparing the muscle to lengthen and release, and then start by gliding with the fiber orientation while adding some length at the same time. I do this at first moving down along the muscle and then up, pinning it down as I stretch it out. And notice how I'm adding some rotation inward as well. Now I do something similar to the iliacus, which is the main hip flexor, a muscle that when it's tight will also pull the femur outward, especially right before toeing off. Here, since this is an area that is tender or even ticklish on most folks, I start with easing it in slowly, making circles, and as I descend, just medial to the ASIS, bony prominence, and up along the inner wall of the ilium. I confirm I'm on the right spot by having the client pull the leg up toward their chest into my elbow to feel the muscle contract under my fingers. And now I'm going to pin it and hold it down and wait for it to soften. And once it does, I continue to hold it and then stretch the muscle gently by lowering the leg off the table, like we did for the quadricep. After doing all this, it's a good idea to start moving and take advantage of all this new range of motion that we created and put it to good use with exercise. Now the goal here is to decrease strain on the plantar fascia. After we put the foot on the ground and the foot moves through pronation, we want to do whatever we can to move the foot back into supination, to rigidify that midfoot and to allow for a clean toe-off phase. We especially want the big toe to extend, because if we can do that, that's what shortens the plantar fascia, causing the foot to supinate, at least in a perfect world, and to allow you to effectively push off your foot. Now related to this, we want the ankle to move through dorsiflexion with the toes pointed forward, otherwise you get the foot turning out and don't have an effective push off or the supination of the foot, all that stuff you don't want. Let me show you what movements I suggest you do to address this. This seems simple, but there are some things to look for. Make sure the outside of your feet are parallel. Keep your knees straight, but your front thighs relaxed. Hold for about 30 seconds at a time. So to see if you can get your foot to supinate to begin with, try blocking the outside of your foot against something. And keeping your big toe down, rotate your lower leg bone outward without moving your pelvis. I would try holding it in an arched position and then try pushing off with your big toe. As we mentioned a bunch, we want the big toe to really be able to extend well. So by pushing the big toe up against a baseboard, that's going to make sure I have plenty of range of motion to toe off properly, shorten the plantar fascia, and re-supinate that ankle. You know how we talked about muscles that tense up and cause our leg to turn out? Well, they also limit hip extension. Well, the quadricep and the hip flexor especially limit hip extension. And if you don't have hip extension, then the muscles in the front of the hip, like the iliacus and like the vastus lateralis, get tight. And when you need to push off, you end up turning your foot out, which again pushes that big toe to the outside, pulls that abductor hallucis muscle, and compromises that little artery that goes to the plantar fascia. So here, after doing the big toe stretch, the calf stretch, I would put your foot up on either a step or a chair at home and move your hips forward, keeping your shoulders back over your hips, and keeping your toes of the back foot pointed straight ahead. Try to keep your knees straight but also relaxed. And as a bonus, if you can tense up your abdominals, pulling your pelvis back, that'll stretch the hip flexor from the top as well and not cause your back to extend, which is the compensation. So the goal is to be able to push off our toes when we walk, and we can do this also by heel raises, but we also want to get the foot to supinate at the same time. So here I'm squishing a ball between my heels as I do heel raises, and that just emphasizes that posterior tib muscle to re-educate the foot to supinate while we're toeing off. This one's kind of fun. You want to stand on one foot and holding a band that's pulling perpendicular to you, push the band away from you, which is going to cause the foot that you're standing on to try to turn in, but you want to fight that tendency. It wants to pronate and you want to keep it supinated as much as possible. You should feel muscles around the outside of your leg and your calf working to keep the foot supinated as much as possible. And that's it. These are some things I would do for plantar fasciitis as a personal trainer, massage therapist, and even at work as a PTA in outpatient physical therapy.